All right, so then type 1 diabetes mellitus. So this is why it used to be called juvenile diabetes. The typical age of onset, that's when you see these symptoms and diagnosis, is usually under 20 years. This is why it was called juvenile. And insulin dependent, that means these people with type 1 diabetes mellitus, they need insulin. So why? Because their pancreatic beta cells aren't producing enough of this insulin. This is why they need to supplement it. And it's relatively rare compared to type 2 diabetes mellitus. So again, we had, what was it, that 30 million Americans with type 1 diet or with just diabetes mellitus of any sort. But notice that this is only like 1 million, just a little over 1 million Americans live with type 1 diabetes mellitus. So it's the minority of cases, still important, but again, this is the one that doesn't or isn't the majority of type diabetes mellitus cases. And this is probably one of the more famous people living, celebrities with type 1 diabetes mellitus. And I believe this is Nick Jonas, all right? So if I get that wrong, because I know I got that one wrong one year, and oh, you should have seen the class. Someone's like, I swear some of the girls had pitchforks for me after the class, like, how dare you got it wrong. But yeah, so he's probably one of the most famous people with diabetes mellitus right now. But what does he have? Well, again, normal insulin signalings and blood glucose, how does that affect? Insulin, it binds to its receptors. This causes transporters to appear at the cell surface of the cells. These transporters move glucose into the cells, thus lowering your blood sugar. Now, what happens in type 1 diabetes mellitus? So what we have with type 1 diabetes mellitus, remember, insulin dependent, so they need insulin. But something is happening to their natural production of insulin. So if you have the lack of insulin, what happens? Well, if you have lack of insulin, can you activate the receptors? Nope, you don't have any receptor activation. If you don't have receptor activation, can you have the glucose transporters appearing at the surface? Nope, you can't either. So what happens to the glucose? Well, you can't absorb them into your cells, so where do they stay? They stay in your bloodstream. And what happens, and if they continue to stay in your and accumulate in your bloodstream, what happens to your blood sugar? Does it go up or does it go down? Actually, let's ask the chat. So no insulin in this picture. It's out of the equation. What do you think will happen to this person's blood sugar over time? Up or down? Yeah, so it looks like most of you are saying, yeah, the blood sugar will go up, and you're correct. Because again, if there's nowhere for it to go, it's going to stay in your bloodstream. So then what we have? So again, hyperglycemia, the definition we'll use for this class is blood glucose concentration over 110 mg per deciliter. And this is why you get, again, those symptoms, all those symptoms of hyperglycemia we covered in the previous lecture. So polydipsia, polyuria, so increased thirst and urination, increased hunger as well, because they're thinking, oh my God, their cells are sending signals like, hey, we're not getting enough nutrients. The nutrients are there, it's just not getting to the cell. So they're like, oh my God, like I'm thirsty, I need to eat. And they also experience things like neurological conditions like blurred vision, fatigue, and explain weight loss as well, and ketoacidosis. And I think ketoacidosis we'll cover more in metabolism later on in the semester. But yeah, this whole laundry list of symptoms with uncontrolled diabetes or type 1 diabetes. Now, what happens with blood glucose? Yeah, so here we have all the glucose, and then is that what Iz had? I forgot his history. I forgot what if he had type 2 or type or what. Or actually, we're going to get into that, but yeah, I forgot what his medical history was. But what we have here, so we have insulin being secreted by cells. Which cells? Yeah, our beta cells, right? So you have all the insulin receptors, so this is what should happen normally, right? You have all this blood glucose, your beta cells secrete insulin to help move that blood glucose into your cells, and then via these glucose transporters. But in type 1 diabetes, something happens to this system. What happens is that in people who have type 1 diabetes, their immune system produces antibodies. But unlike the ones we saw in the previous example with Graves' disease, these antibodies are attacking and destroying these beta cells. So what happens is that these beta cells die in the pancreas. So if you don't have beta cells, can you produce insulin? Nope, you can't, right? So you're going to have a lack of insulin because your beta cells have been attacked by these antibodies against your beta cells. So lack of insulin, what happens? Well, lack of insulin signaling, lack of glucose transporters on your cells. So you have glucose, and what is your body going to try? What does your body want to do? It wants to lower the blood glucose by making insulin, but if there aren't any cells that are making insulin, what happens? Well, these glucose molecules stay in your bloodstream. So the next wave of glucose comes, but there's no insulin. And what happens over time? Well, no insulin signaling, no GLUT4 transporters. This glucose starts to accumulate in your bloodstream, and this is what we have with this extreme hyperglycemia we're seeing right now. How do you treat type 1 diabetes? So what you do is give them insulin. So they can't produce their own insulin, therefore they need insulin from somewhere else. Yeah, so type 1 diabetes is the main cause of type 1 diabetes is autoimmune response. Yep, attacking your beta cells. All right, so then recombinant insulin injection. So long time ago, before even I was born, I think they actually need to use like cadaver insulin, but then they started using porcine insulin, and then now they have recombinant insulin. So this is what they do. They can either have, I think it's bacteria or yeast, but they can put the human gene for insulin into these bacteria or yeast, have them crank out a bunch of insulin, and then purify that. So they're not going to just inject bacteria in you. That would cause septic shock. But they're able to, like these microorganisms, they can take the human gene for insulin, and they tell them to crank out a lot of insulin, purify it, like they really purify it because it has to be safe to inject, and then give it to the patients who need insulin. That's why it's ridiculous, some of the prices for insulin, because like if you've worked in a lab, you know it's very easy to grow bacteria and crank out a bunch of this protein. I'm like, okay, it shouldn't cost that much. Like, yeah, I blame pharma for that. So insulin pumps as well, but still going to use insulin somehow, and more advanced insulin pumps. Like I never needed one, or don't know anybody. I know a student, but I'm not going to ask my student, like, can you show me your pump? But the thing is, like, yeah, they're getting more sophisticated. So I think the one of my students had, like, it could actually measure his blood sugar and give him the right dose of insulin and kind of keep his blood sugar levels stable throughout the day. It was really cool. Yeah, so this is what Nick Jonas, right? Nick Jonas is showing here, right? So his insulin pump. Okay, so this is how you treat type 1 diabetes mellitus. You reintroduce insulin to the body, and the insulin receptors are still there, but now they have insulin. Now you have insulin signaling. Now you can have glucose transporter appearing on the surface of these cells. And finally, you can have reabsorption and lowering of your blood sugar by moving it from your bloodstream into your cells.